So you give this together with treatment for gonorrhea and chlamydia. Gonorrhea, you'd like to give cetirizine or ceftriaxone, whichever. Ceftriaxone, i-inject lang. Plus, either doxycycline for 7 days or azithromycin, 1 gram single dose. Right? So, bigay mo lang dyan, 95% of the time, gagaling yung patient. Syndromic approach. Kahit sa telephone lang, pwede kayong mag-ganyan. Sabi niya, kumari. O yung recurrent, dapat i-refer niya na. Hindi na pwede syndromic. Okay? Are we okay with this? Okay. Clinical approach, dito tayo medyo nakaka-problem. So, in order for you to go clinical, you have to differentiate between physiologic meaning normal lang yan, no? Dahil sa physiologic, and abnormal vaginal discharge. That's the first question you have to answer. Pupunta siya sa'yo, tanongin mo siya. Tanongin mo sarili mo, is this normal or abnormal? Kasi yung iba, depende sa cycle, dumadami yung discharge, di ba? Kasi nyo rin siguro yan among either yourselves or your patients. Depende sa cycle. O kaya kung minsan, depende sa gamot na iniinom. Mag-iiba yun siya. So it can be physiologic or non-physiologic or abnormal. After that, kaya sabihin mo, you have to differentiate between vaginitis and cervicitis. So kaya sinabi mo, ay, abnormal yung discharge niya for some reason. I'll mention the reason and why. Abnormal. So, abnormal ito, is it vaginitis lang or cervicitis or both? Right. And then identify what laboratory tests you might need to help you. And then prescribe treatment for the different causes of the discharge. And lastly, you have to provide counseling. Yan ako sa ating patient about the discharge. Right? Okay. Punta tayo sa first question. Is this normal or abnormal? When do you say vaginal discharge is abnormal? And there is follower. Parating abnormal yan. Pag mabaho. Ang problema, yung iba patients, hindi alam na mabaho na pala. Hindi mo ba? Nangyayari yun, di ba? Pag tanongin mo, may buntis. May nararamdaman ka ba? May discharge ka ba? Wala ako. O kaya, meron pong discharge. Mabaho ba? Hindi mabaho. Hindi, may examine. Pag lang niya, parang ginano ka na, parang suntok ka na sa baho. Kasi nga naman, di ba, sense of smell, it adapts. Di ba? Kung may katabi kayo, kung kanina niyo pa katabi, yung pabango niya ngayon, hindi niyo na alam na may pabango siya. Pero nung una yung nakatabi, ang bango mo. Pero after a few minutes, parang wala na kasi nag-adapt na yung sense of smell mo. Just like these patients, hindi enough na tanungin mo, mabago ko ba or hindi. Kailangan, tignan mo, and amoy-amoyin mo rin. That is one of the hazards of our trade, unfortunately. Concomitant pruritus, makati ba? Pag makati, parating abnormal yun. Burning sensation, makati, lalo na pag nababasa or nahawakan. Greenish, pus-like, discoloration, and also associated with bleeding. So, tanongin niyo lahat ito. Yung discharge mo, notice anong pagkakaiba dito. Ano pa siya? Walang about amount. Kasi yung iba, kung sa dami lang, masyadong madami, unusual sa akin. No? So, not always abnormal yan. Baka naman may nakain ka o kaya may mainom ka. So, one or more of these may be present in normal vaginal. So, these are the things that will help you would say whether it's normal or abnormal. And sorry, determine the cause of the abnormal vaginal discharge. How do you determine the cause? Well, you want to tell whether it's vaginitis lang, vaginal abandon, or cervix. Bakit? Kasi pag cervicitis, pag yung cervix involved, GC and chlamydia na yan. Pag vaginitis lang, ibang organisms yun, mild lang yan. No? Or you want to check if it is from a benign tumor or from malignant tumors, cancer of the cervix, or foreign body. Baka may naiwan sa loob. How can you do that? How can you do? Only by doing a speculum exam. So please take time to do speculum exam on all your patients, especially if they complain of vaginal discharge. There is no way at all, if you're doing clinical approach, to tell you this kung hindi nyo gawin ito. So the single most important thing that you can do a speculum exam. Like speculum exam to visualize the vaginal canal and cervix is mandatory. It allows the detection of all of these, cancer, polyp, and all of these, foreign body, etc. Unless you do this, hindi kayo clinical approach. Probing ka. And of course, what do you see? Kunyari, cervicitis. Paano sasabihin speculum mo? Cervicitis ito. No? There are two things that you can check after doing a speculum exam. One is take a cotton swab. May cotton swab. Pasok mo sa cervix, ikot mo konti, and then labas mo, tingnan mo yung sa white background with proper lighting. Kung medyo yellowish or greenish, cervicitis yan. That's one test. The same test, imbis na pasok mo sa loob, sa may bungad, medyo ikot mo konti, or ganun yung cervix. Pag nag-bleed yung cervix, cervicitis din yun. Cervicitis. Pag wala, hindi yellow-green, hindi nag-bleed, walang cervicitis. Simple test that you can do yourself. Very easy to do. Walang exotic laboratory test. But you need a speculum, light source, cotton swab. Okay? Pag wala yun, there is no cervicitis, you have to check for vaginitis. Walang cervicitis, pero may discharge ka from the vagina, mapula yung vaginal walls, vaginitis yun. Then yung discharge mo nandun sa may vagina also. Okay? So that's your objective. Is it vaginitis lang? Or may cervicitis kasama? Cotton tape. Cotton swab. Right? Kung vaginitis lang, they may be due to infectious and non-infectious process. Okay, meron siya ng cervicitis ko? Okay. Walang cervicitis, pero may vaginitis. Ano ngayon ang vaginitis? Pwedeng due to infection, pwedeng due to hindi infection. Ito yung mga non-infectious causes. Non-infectious. Hindi lahat ng vaginitis o vaginal infection. It can be due to mechanical trauma from vigorous sexual intercourse or even gynecologic instrumentation. Irritation following use of strongly scented intravaginal douching solutions and other chemicals. With due respect to some of our sponsors, ang dami-daming vaginal products ngayon. I'd like to disclose, retainer ako ng Vitel makers of some of these products. And sometimes they're misused. Mga nag-douche ng, again, I apologize, betadine douche every day, yung mga ganon. Para daw malinis sa loob, yung ganon. And all of these strong chemicals, they can cause irritation. So, tanongin mo sa patient, ano ginagamit mo siya? Nung mas bata-bata ko, I was rotating sa, I don't know if you know, may mga taga-ano ba sa inyo? Kirikada. Wala yung kirikada sa Manila Social Hygiene Clinic. Yung mga, sa pati naman yun sa Nazaro, malapit ko. Yung Social Hygiene Clinic ng Manila. Nag-rotate ko ako for several months as part of my training in infectious diseases. Yung mga nagpapa-smear sa amin doon, of course, yung mga sexual workers, nagpapa-radio sila ng pink slip. Maniwala kayo, siguro pag nilista ko yung mga ginagamit nilang intravaginal products, mahabang-mahabang listahan. Toothpaste, kung ano-ano, pinag-ano. Bakit mo tinutoothpaste yung vagina mo? Fresh. Para fresh.